The ketogenic diet has multiple actions, and one of the very important, very interesting and a novel way of using this diet is going to be in the cancers. And when I say cancers, I mean 90 to 95% of all cancers will respond to this simple ketogenic diet. Cancer is a horrible thing. The minute someone knows that he has cancer, or the family knows that someone has cancer, the reaction is, oh my God. Oh my God, what's going to happen to me, or what's going to happen to him or her? Because in spite of the billions of dollars that is going in every year into cancer research, we really have not been able to change the outcome of cancer. It has changed in a few areas, like the hematological cancers, where now you can have a good cure. But in a large majority it hasn't, and I'll just name some of them. One is the high-grade gliomas. The gliomas are basically cancer tumors in the brain. The pancreatic cancer, which is like a death sentence. The liver cancer, as bad. The bladder cancers often will spread. The ovarian cancers, also the same thing, if not caught early, can spread. The breast cancers, once it has spread, and in fact any cancer which has spread, there is really no good treatment or cure. So what has happened in all these years? The incidence of cancer has remained the same or has gone up marginally over the last 15-20 years, and I'm quoting from the American Cancer Society figures. It's around 0.5% of all people all over the world will have cancer, and it has increased over the years due to various factors. The most important is the lifestyle change. It's now known that about 85 to 90% of all cancers are due to this lifestyle change. One is we are having much less physical exercise. Our food has changed. We eat a lot of packaged foods. We eat a lot of processed foods, and they all contain chemicals which are carcinogens. In our environment, we have a lot of carcinogens. The diesel exhaust is one of them. So you can just imagine what's happening all over. Tobacco, forget the fact that you may not be smoking. Second-hand smoke can increase your risk of cancer. Simple things like talcum powder, cosmetics, antiperspirants, even your cell phone which you're using and you're getting low-level radiation, the cell phone towers, all these are all increasing the incidence of cancer. Let's go to some of these very severe cancers where it's almost like a death sentence. Take the gliomas of the brain. The median survival rate, meaning that on an average, once you are diagnosed with this, in spite of surgery, a lot of advancement in that, radiation, the best techniques, chemotherapy, the latest chemotherapy, the median survival rate in the last 10 years has increased from around 14 months to 16 to 17 months. So with billions of dollars spent on research, with medication, this chemo, mind you, costs around 2 to 3 lakhs a month. And what do you get? 2 to 3 months more. So really we got to look elsewhere. And the elsewhere we got to look is, we got to look, why do you get cancer in the first place? Now that is unfortunately something that hasn't really been looked at, though it's been there in our books since ancient times. Louis Pasteur, 200 years ago, he noticed that these cancer cells, their metabolism is abnormal. Now, what do you mean by metabolism? Every cell, the metabolism is basically from the mitochondria. They are little organelles which create the energy for the cell. So what happens? These mitochondria which are in the cells, they become abnormal due to all the factors that I've spoken of before. You know, all these things about pollutants and chemicals in our food and the change in the lifestyle, these have caused our mitochondria to change. In all of us, we have two genes. One is known as the proto-oncogene, which if changed can become an oncogene and cause cancer. And we have the tumor suppressor gene, which will suppress this. They are in balance. So any one of us can get cancer if this balance is shifted. And that is how these carcinogens work. They shift the balance so that the oncogene takes over, and the oncogene will cause rapid multiplication of cells. Oncogene is like an accelerator in your car. If your accelerator is stuck, you're going to go on accelerating. You can't stop that. The tumor suppressor gene is like the brake in your car. So when you put on the brakes, that gene will cause the multiplication to stop. But if that is abnormal and the brake fails, you can't stop the multiplication, and then you get a tumor. So that is the basis. Now, what is the difference between the metabolism? And that is what has been talked about by Louis Pasteur a long time ago, by many others, and especially a German scientist called Otto Warburg. Otto Warburg did these experiments, taking off from where Pasteur had done his experiments, and he showed that the difference between the cancer cells and our cells is that in the mitochondria that is changed so that these mitochondria utilize carbohydrate in the form of blood glucose, and that glucose is converted into lactate. Our normal body cells convert glucose into carbon dioxide and water. Carbon dioxide we exhale, water we pass out in the urine. These cancer cells, no, they don't do that. They use the glucose but convert it into lactate. Lactate does two things. Lactate, first of all, will increase the multiplication of the cancer cells again. So it's like a vicious cycle. Cancer cells form lactate. The lactate in turn will cause the cancer cells to grow. The second is that this lactate causes the blood vessels to increase, because a tumor needs to be fed. And how many times? That's another fascinating thing. Every cancer cell of yours and me and anyone who gets cancer will use 18 times the amount of energy that our normal body cell uses. It's that much faster and requires so much more energy. And they are solely dependent upon carbohydrate in the form of blood glucose. So this is the difference. And when you heard of the ketogenic diet, you heard how we can use either glucose or ketones. The ketones are anti-epileptic, but the ketones also give 50% more energy. The ketones act on abnormal mitochondria and make them normal, and the ketones have many other actions. So at that time it was thought, why not target this metabolic difference between the two? And these experiments have just come up in the last 8-10 years. One of the famous biologists from Boston, Dr. Thomas Seyfried, has done yeoman work in this. He took rats, injected their brains with these abnormal cancer cells, and he gave one lot of rats normal food. The other lot of rats, he gave them a ketogenic diet, meaning high fat, low carbohydrate, normal protein diet. And what did he find? Within a few weeks, the brains of those who were allowed to eat anything, which means a high carbohydrate diet, they had huge tumors, and the brains would then literally bulge out. And it's very dramatic to see that. While those rats who were given this ketogenic diet, it didn't grow. So that showed him that diet can cause a lot of changes. Speaking of the diet, let me get back to something very interesting. Do you know that there is an island in the South Pacific called Tokelau? And in this island, they are not allowed to emigrate. They don't get food from outside. and the missionaries have been working there for over 200 years. They eat only fish, coconut, fruits, nuts and leaves which are available. And they found that no one on that island had either cancer or diabetes or hypertension or ischemic heart disease. And then 50 years ago, the governments of New Zealand needed people to work on the farms. So they said, okay, you can now emigrate. And those who emigrated began eating the food of the New Zealanders, that is white bread, pastas, pizzas, etc. All of them, not all of them, but a large number got diabetes, some of them got hypertension, and a few of them even got cancer. So what does it tell us? It tells us what Ayurveda had said a long time ago. When your food is wrong, when your diet is wrong, medicines are of no use. But when your diet is correct, you don't need medication. So that shows us that diet is a major contributor to our incidence of all these three, namely diabetes, hypertension and the cancers. So how do we target these cancers? Simple. Take a ketogenic diet. Now as soon as people hear from me this, they say, what? Just a simple diet can make me all right? No, doctor, there must be something wrong. And what is the reason for this? Because it doesn't cost much. And unfortunately, over these years, we have equated the amount that we spend on medication with the efficacy. Cost is equal to efficacy. It's not so. Cost may be low and your efficacy may be high. I showed you. You spend 2 to 3 lakhs a month and what do you get? 2 to 3 months more of life. Let's take a very simple example of aspirin. Aspirin costs you a few paisa. But what has aspirin done? It's called as the miracle drug of the 20th century, which has been refound. It has been resuscitated. Aspirin, which was used just for headache and pain, today is a big player in the prevention of heart attacks and in paralytic strokes. It's one of the major reasons why the incidence of heart attacks and paralytic strokes is going down. So it's a very simple drug, it's a very cheap drug, but it acts in very many ways. So is the ketogenic diet. It's not expensive, but it does not mean that it is not efficacious. And we are going to show you one of our patients who is a young boy who had a malignant ependymoma in his brain. He was operated 4 times, radiated 4 times, given chemotherapy 4 times. Every time it recurred. It not only recurred, but it spread from the brain into the spinal cord. And that is one of the worst things. Because once it spreads, it usually means that now you can't do anything. And that is what he was told. Sorry, now we can't do anything. We've come to the end of the road as far as radiation and the chemo goes. So he came to us. He's been with us for about a year. This boy, young teenager, who could not stand on his own. He needed 2 persons to hold him in order to stand. He would leave alone walk. Today, he stands on his own and he walks on his own. That's the improvement. The spread which was seen in the spinal cord has disappeared. And the tumors in the brain have become less. You ask me, is this going to be a cure? Well, we don't know, because the number of patients in the world who have gone through this ketogenic diet are very few. Mind you, in Asia, probably this is the only center working on this ketogenic diet with cancer. There are a few in the US, a few in Europe, and 1 in UK. Even the UK, I think they're just about to begin their work. So it's very early, but we do know that some of them have shown improvement where chemo and radiation have not worked. So we do know that they improve. How long will this boy need to be on the diet for full cure, for those tumors to totally disappear? I don't know. It could be 3 years, it could be 6 years, it could be 8 years, it could be 10 years. I really don't know. But in 1 year, he has improved. Now you're going to say that, oh my God, you're going to be on diet for so many years. But this is a very easy diet. This is not a difficult diet, and we have patients on uncontrolled epilepsy who have been on diet for 8 to 10 years with no side effects whatsoever, number one. Number two, we have patients in the Johns Hopkins, who is one of the premier institutes for work in the ketogenic diet in the world, and they have been on the ketogenic diet for 25 to 30 years. We also know that this diet has no major side effects, and the most important, you're going to think, oh, can I not eat my usual food? Yes, we have made a new wonder powder. You can get idlis, dosas with sambar, you can have bread and cake, you can have malpoha, you can have parotas, puris, you can have shev, you can have sev gatia, you can have puffs, you can have dokla. So there are more than 130, 140 items that you can have recipes, but you can't eat outside. So with all these recipes, and we have more than 130 to 140 of them, there's really not much that you can't eat, only it has to be tailored. It has to be individualized, and it has to be given by a doctor and a dietitian team, because we have to make sure that you get all your nutrients. We have to make sure that you get adequate protein. We have to make sure that the calories are such that you do not lose weight or gain weight. So we keep you at your ideal body weight. In fact, as you may know, that this low carbohydrate diet has been used for some time for weight loss programs, which is the Atkins diet. It's a very famous diet known as the Atkins diet. Well, this is you can say is a modification of that. There is a modified Atkins diet and the ketogenic diet which we use. These are all low carbohydrate and high fat diets. So while this diet works in uncontrolled epilepsy, it works in cancer, it works in autism, it will work in many other conditions which are yet being researched. This diet is simple, cost effective, and most important, has no side effects. Thank you.